Abdominal examination begins with inspection. Abnormalities such as distension, scars, stretch marks, hematomas, and engorged veins can provide the first evidence for conditions involving the abdomen. The abdomen can be separated into individual regions to more precisely depict anatomical location. A classical distribution consists of 4 quadrants that are separated right from left by a single vertical plane and superior from inferior by a horizontal plane. Another common scheme divides the anterior abdominal wall into 9 anatomical regions. As part of this distribution, the upper, middle, and lower abdomen are separated into thirds. These regions enable more specific findings during examination. In contrast to examining the chest, auscultation of the abdomen should occur before palpation. Otherwise, stimulation of the bowels may trigger a false increase in peristalsis. Bowel sounds are physiologically heard as clicks and gurgles in an irregular pattern. Hypoactive or absent sounds can indicate a paralytic ileus, resulting postoperatively or from a condition like peritonitis. Hyperactive sounds may indicate gastrointestinal infection or trying to overcome obstruction, which could imply a mechanical ileus. Besides bowel sounds, an aortic bruit due to an aneurysm or stenosis may be auscultated at the upper umbilical area. Listen for possible renal artery bruits bilaterally from this area. Assessing percussion sounds is helpful in determining the size, position, and density of abdominal contents. Solid organs, fluids, or tumors lead to dull sounds that may sound similar to percussion sounds of the thigh. In contrast, the percussion sound of hollow, air-filled intestines is more drum-like in nature and is therefore known as tympanic or tympanitic. Tympanitic sounds are even more extreme in conditions involving the accumulation of excess gas within the bowels, as seen in abdominal bloating. A distended abdomen has various causes, including adiposity, bloating, a tumor, or ascites. In addition to percussion, being able to form a belly fold may help in determining the cause. Physiologically, the examiner should be able to form a small belly fold. In contrast, in patients with massive ascites, it would be difficult or not possible to do so. The most reliable clinical sign to detect ascites is checking for shifting dullness. If a patient with ascites is lying supine, fluid accumulates in the flank regions, leading to dullness on percussion. At the same time, the air-filled bowel loops are forced upwards by the free fluid due to buoyancy, resulting in tympanitic percussion. To locate specifically where dullness shifts to tympany, or the air fluid level, percussion should be performed from the sides towards the middle. To confirm that the dullness is caused by ascites, ask the patient to switch to a lateral decubitus position. If ascites is present, the air-filled bowel loops will shift accordingly and remain at the surface of the fluid. As a result, the air fluid level will shift as well. This is known as shifting dullness. Palpation should be conducted last. It can be uncomfortable for some patients, causing them to tense up. To help relax the abdominal muscles, you can try distracting patients with a conversation or asking them to breathe deeply. To prevent the patient from tightening the abdominal muscles, otherwise known as guarding, it is important to begin palpating at a point far from any painful areas and to avoid using cold hands. Begin by shallowly palpating the surface. Doing so may already elicit involuntary guarding that could indicate peritonitis. Pay attention to the patient's expressions, such as flinching, as they may help in interpreting pain. Now continue by systematically palpating deeper to assess the abdominal organs. Take note of any pressure pain, rebound tenderness, or abdominal masses. Palpating a normal-sized liver is sometimes difficult. It usually extends beyond the rib cage in the area of the right midclavicular line, and traverses the epigastric region. Even in this region, the liver can only be felt through deep palpation. Start the examination by asking the patient to exhale. Afterwards, as the patient is inhaling, slowly slide your fingers towards the right rib cage so they are near the liver's edge. When the lower liver edge is felt, its surface structure, consistency, and size can be evaluated. Since a severely enlarged liver can extend as far as the lower abdomen, palpation should start further down in the right lower quadrant. If necessary, bimanual palpation can help locate the liver in patients with a larger abdominal diameter. Another possibility to determine the size of the liver is the scratch test, although its reliability and precision remain controversial. One method is to place the stethoscope on the chest just below the xiphoid process. Lightly scratch the abdominal skin in the right lower quadrant with a fingernail, parallel to the expected liver border. The air-filled bowel loops under the fingertip poorly transmit the sound waves to the stethoscope. Proceed with the scratch test by gradually moving cranially towards the rib cage. The transition from bowel to liver tissue, through which sound waves can travel more intensely, is notable for a sudden increase in loudness of the scratching and marks the lower liver border. Continue the scratch test further upwards until a sudden drop in loudness is observed, marking the transition from liver to lung. This is where the upper liver border is located. In this patient, percussion, palpation, and scratch test reveal a physiological liver size. The craniocaudal length of the right liver lobe in the midclavicular line is around 10 centimeters. These examination techniques can help in examining a suspected hepatomegaly, but do not replace the standard clinical practice of abdominal ultrasound, which helps assess the liver more precisely. Assess the gallbladder next, which should only be palpable in a pathological state, for example, if hydrops is present. Palpation takes place somewhat medial to the midclavicular line below the right rib cage. Evaluating for tenderness on palpation is important since it may indicate cholecystitis. Cholecystitis can also be evaluated by testing for a positive Murphy's sign. To test this sign, first ask the patient to exhale while palpating the gallbladder area medial to the midclavicular line. Now, instruct the patient to take a deep breath so the gallbladder is pushed down and against the examiner's fingertips as the lungs expand. If cholecystitis is present, the patient will experience a sharp and sudden pain, causing an abrupt halt to inhalation. This reaction is known as a positive Murphy's sign. The spleen is generally not palpable in healthy adults. A pathologically enlarged spleen is palpated under the left costal margin during inspiration, as the inferior edge descends to the examiner's fingertips. If an enlarged spleen is already suspected, palpation should begin further down. The examination may be facilitated by gently lifting the left flank of the patient ventrally.
Okay, so I'm going to start by looking at your belly. So I'm going to look from here, and I'm looking at the contour, which is the fancy word for shape. And your abdomen is a little rounded. And then I'm going to come down here from the foot of the bed and look for symmetry. Both sides should be the same, which they are. And then I'm going to come back here and I'm going to look at your umbilicus, or commonly known as the belly button, and looking for any lesions or any problems or any skin discolorations, or many young people have a piercing here, so you would want to note that. And then I'm going to look at the abdomen overall for skin color and any lesions. This is a common place for moles. And so we do look at moles as part of skin assessment, but also part of the abdomen, that you would be looking at the skin for anything abnormal. And then also I'm looking for movement. I should see normal respiratory movement of the abdomen, which I do see. And also right here in the epigastric area, many times you can see the pulsations of the aorta. That is a normal finding and is seen commonly. Some people you can see it, some people not. Usually in thin people it's visible. And I do see the aortic pulsations here, and I see the respiratory movement, that's normal. I do not see any waves of peristalsis. It's uncommon to see, but you do want to look for that. And then I'm going to move on to auscultation. When we do assessment of the abdomen, we do auscultation after inspection, prior to palpation. I use a diaphragm of my stethoscope, and I make sure to listen in all 4 quadrants. And what I'm listening for is vowel sounds. Vowel sounds are kind of tinkly sounding. So I'm listening in all 4 quadrants. Usually you go around like a clock. You can start in any quadrant that you want. And when you listen to vowel sounds, you would need to determine, are the vowel sounds normal, or are they hypoactive or hyperactive? This is something that you will learn as you listen to more abdomens and you train your ears to hear vowel sounds. It's very difficult to count vowel sounds and to have a very specific number that equals hyperactive as opposed to hypoactive. So this will come with more experience. Then we're going to move on to palpation. So we start with light palpation across the whole abdomen. You want to cover the whole abdomen. And usually, again, you go in a clockwise method, but you want to make sure that you cover the whole abdomen. So I'm going to start by just pressing down about 1 inch and using a rotary motion and all over the whole abdomen. And Mr. Hoffman, let me know if there's anything that feels tender. And is there any area of your abdomen right now that's bothering you that feels tender or painful?
Nope, not at all.
All right. So if there was an area that was tender, you would want to save that for last. If you palpate the tender area first, you're going to be done with your assessment because the patient will be not happy with you. Okay. So now I'm going to palpate your abdomen a little. I'm going to press a little bit more this time, so you're going to feel a little bit more. So now I'm going to press in about 5 to 8 centimeters. So sometimes this can be difficult. People kind of tense up the abdominal muscles as you're doing this. Maybe it feels a little uncomfortable or they're a little bit ticklish. So you want to try to help your patient to relax while you're doing this. So you just want to make sure you cover the whole abdomen. All right, good. All right.
Just making sure that I don't hear any sounds that could be worrisome, okay? Alright, in here. And when's the last time you ate?
About 5 hours ago.
Alright. I hear some sounds over here. There's definitely some indigestion happening or gurgling that could result in just some disturbances in the way your intestines are processing the food. Okay. I'm going to, if you don't mind, just unzip your pants just to get a little lower so I can here lower and also check your ovaries later.
Okay.
Okay. Okay. Okay, thank you. All right, so just keep breathing deeply. All right. Okay. All right. So I'm just going to be doing some percussions and palpations, okay? So just keep breathing deeply and let me know if you feel any sharp pains, okay?
Okay.
All right. I'm not noticing any signs of organ enlargement. Okay. I'm just going to feel a little deeper here to get into your kidneys, okay? Okay. Okay, everything feels healthy so far. Okay. Just going to do some light percussions. Okay. Your liver feels normal and healthy. Okay. All right, very good. I'm just going a little deeper to check your ovaries. All right, great. So that feels very normal to me. Okay. Any pain here? Okay. Okay, excellent.
Today I'm going to be inspecting your abdomen, so I'm going to pull your shirt up. First, I'm going to inspect your abdomen, so I am going to feel the temperature. Temperature is equal bilaterally and the abdomen is warm and dry with no lesions, rashes, and normal coloring. Next, I'm going to inspect your abdomen. The abdomen is flat with no abnormalities. Next, I'm going to auscultate the bowel sounds. So I'm going to start in the right lower quadrant and follow the large intestine. So I'm going to start here. Okay, bowel sounds are active in all 4 quadrants. Next, I'm going to palpate. I'm going to start here. I'm going to start light and then go deep. Any pain while I was palpating? Okay. No noted abnormalities or masses in the abdominal region.
Can I have a look at your tummy? If you could lift your shirt up and just push your skirt down a bit. That's good. Thanks very much. I'm just going to feel your tummy now. Does it hurt you anywhere?
No.
Good. Now I just want to feel a bit more deeply. Not hurting you. Good. I want to feel for your liver. If you could just breathe in and out deeply. Good. And just keep going with deep breaths in and out. Okay. Just going to feel your left kidney. Could you just roll towards me a little? That's good. And now just rest back. Okay, same on this right side. If you could just roll away from me and rest back again. Good. Now I'm just going to tap on your tummy. Okay, and last thing is just to listen for some bowel sounds. That's fine. Thanks very much.
So I'm just going to feel your tummy now. If it's sore at any point, can you let me know, please? Okay, I'm just going to feel a bit deeper now. That's okay. Okay, can I get you to take a nice deep breath in for me? And out. Okay, and again. And out. Okay, and again. And out. That's brilliant. Okay, and again, nice deep breath in for me. And out. And again. And out. And again. And out. One more time. Okay, that's good. Can I get you to just roll over towards me? Okay, and again, can you take a deep breath in and out? Okay, brilliant. And we just lie down flat again. Okay, I'm just going to feel in the small of your back. Okay, I'm just going to tap on your tummy now. Can I get you to roll over towards me again? Okay, and lie down flat again for me. Okay, brilliant. Let's go listen to your tummy. Okay.
Okay, now so I'm going to be doing a very detailed examination of your abdomen. I'm going to start by first listening to your abdomen. Do you mind if I lift this up a little bit? That's fine. Okay. Your abdomen sounds pretty normal. Okay, I'm gonna do a visual examination of your skin. I do notice a scar here. Do you know what this scar is from? I had a mole removed. Okay. How long ago was that? About a year. Okay. Seems to be healing pretty good. Okay. Okay, besides that, I do not notice any other scars. Anything that would indicate hernia. Do you mind if I open your pants a little bit? Sure. Okay. Are you comfortable? Is that okay? Okay, very good. Okay. Okay. Yeah, I do not notice any discoloration of the skin. Or any other scars that would be concerning. Okay, so the belly button seems to be normal size. It's not. Is there any pain?
No.
No. Okay, so it's not tender to the touch. Very good. Okay. I do want to go ahead and measure your scar. Okay, that is okay, that's 8 millimeters. It is a little bit raised from the skin. There is a slight slight change of color. It's a little bit darker than the skin tone. Okay. Okay, I'm going to start palpating your abdomen. Please let me know if there's any tenderness or discomfort as I'm doing that. Okay? Just first a general assessment. Make sure there are no tender areas. Do you remember what you ate today?
We had oatmeal in the morning and 2 eggs.
Did you have any coffee today?
Yes.
Okay, I do not notice any tenderness on your abdomen. Now I'm gonna go ahead and palpate all your main organs in this area to make sure that they're not enlarged. Okay, I'm gonna start by trying to feel your kidneys. Do you mind? Okay. This one seems to be normal size. I do not notice any rough patches. Check here. The other one. Okay, it seems to be normal size again. Small edges. Doesn't seem to be inflamed. Okay, now I'm gonna try to feel your bladder. Okay. Is there any pain here?
Just some fullness.
Okay. Yeah, bladder seems to be normal size. I do not notice any inflammation or any issues there. Okay, so now I'm gonna try to find your spleen. Okay. I'm gonna ask you to please take a deep breath for me. Exhale. Take a deep breath for me. Exhale. Take a deep breath for me. Take a deep breath for me. Exhale. Take a deep breath for me. Exhale. Okay, yeah. Again, the spleen seems to be normal. Okay. And now I'm going to try to find your liver. Go ahead and take a deep breath. Exhale. Take a deep breath. Exhale. Take a deep breath. Exhale. Okay, I do not notice any inflammation on your liver either. Everything seems to be in good shape. Is there any pain as I'm palpating here? Would you say that your belly is hurting right now? Not having pain right now? Okay. But usually when I'm experiencing something like something over here on this side. Okay. Okay, I'm gonna go ahead and tap lightly. I just want to make sure that everything sounds normal. Okay. I don't know if there's any. Is there any pain or tenderness? No. Okay. Okay. Your spleen seems to be very good. All the major organs seem very normal. Okay. And then we'll be.
When auscultating the abdomen, first listen for bowel sounds. You can do this by using the diaphragm of the stethoscope. You should listen for up to 2 minutes to try and determine if bowel sounds are present or absent. If you can't hear bowel sounds in one location, then try another area. You can also auscultate over the renal arteries for bruits. This can be done 2 centimeters to the left and right of the midline above the umbilicus. You could also auscultate over the aorta for bruits, however this has been omitted in this particular examination. If the bed is low, either kneel beside it or raise the bed. It's important for this part of the examination to be at the same level as the patient. You can also ask the patient to bend their knees so that abdominal muscles are not tense. However, in some patients with limited range of movement, this may not be possible. The abdomen is divided into 9 regions, as you can see in this diagram here. Perform light palpation of the abdomen across all 9 regions. Try to start in the area where the person is not experiencing pain. Look carefully here as to how the doctor looks at the patient's face each time he presses on the abdomen to see if there are any subtle clues that the patient might be in pain. Also look at how he's using the right hand, keeping it flat in contact with the abdominal wall. Next, perform deep palpation of all 9 regions. If you find a mass, try to describe it by its site, size, shape and consistency. Next, assess for hepatomegaly by palpating the liver. Start by placing your hand flat on the skin of the right iliac fossa. Palpate for the liver with 1 or 2 hands, palm down, moving upwards 2 to 3 centimeters at a time, moving towards the lower costal margin. Palpate the spleen. Begin palpation in the right iliac fossa starting at the edge of the superior iliac spine. Ask the patient to take a deep breath, and as they begin to do so, palpate the abdomen with your fingers aligned with the left costal margin. Repeat this process of palpation, moving 1 to 2 centimeters superiorly towards the left costal margin. Next, blot the kidneys, starting on the right hand side. To do this, place your left hand behind the patient's back, below the ribs, underneath the right flank, and place your right hand anteriorly. Push your fingers together, pressing upwards with your left hand and downwards with your right hand. This is a bimanual movement called blotting. Ask the patient to take a deep breath and try to feel the lower pole of the kidney moving down between your fingers. Once you've completed this, repeat the process on the opposite side. Palpate the aorta. Do this by placing both hands superior to the umbilicus in the midline. If you feel a pulsatile mass pushing outwards, this may suggest an abdominal aortic aneurysm. However, this is a crude test, and if you suspect something like a AAA, imaging is needed. If indicated, you may want to palpate the gallbladder and bladder. However, in most healthy individuals, the gallbladder is not palpable, and in most healthy patients who are passing urine regularly, the bladder will also not be palpable. Perform hepatic percussion to identify the liver's borders. Percuss upwards 1 to 2 centimeters at a time from the right iliac fossa towards the right costal margin. Once you've percussed for the liver, perform splenic percussion, upwards again 1 to 2 centimeters at a time from the right iliac fossa towards the left costal margin. Once you've done this, assess for shifting dullness, which could be present in ascites. With the patient lying flat, percuss from the midline out to the flank. Note any change from resonant to dull. Keep your finger on the site of dullness in the flank and ask the patient to turn onto their opposite side. Pause for 10 seconds to allow any ascites to gravitate and then percuss again.
Vowel sounds are normal in all 4 quadrants. High-pitched sounds are noted. The next thing I'm going to do is tap on you. Dullness noted over right upper quadrant. Tympany noticed on right lower quadrant. Dullness noted in left upper quadrant. and tympany noted in left lower quadrant. All right, next lightly. No tenderness noted. Good. Now I'm going to palpate a little bit deeper. First, I'm going to feel for your right kidney. Go ahead and take a deep breath in and let it out. Good. Right kidney not palpable. Now I'm going to check for your liver. Go ahead and take a deep breath in and let it out. Liver is not palpable. Left kidney. Go ahead and take a deep breath in and let it out. Good. And spleen. Deep breath in and let it out. Perfect. I'll move on to the abdomen, so I'm going to pull your shirt up a little bit. I'm going to take this. Alright, so I'm going to inspect your stomach, look for any abnormalities. Everything's good. So first off, I'm going to look at your umbilicus, any contouring, pulsations, peristalsis, and then I'm going to listen, okay? So I'm just going to listen to for bowel sounds in all 4 quadrants. Perfect. Then I'm going to listen for any bruits in your renal arteries. Good. Iliac. No bruits. Good. And femoral. Perfect. All right. Now I'm going to palpate for any inguinal lymph nodes, both horizontal and vertical. Everything's good. Perfect. And now I'm going to percuss your abdomen. Where am I? There it is. Good. Now I'm going to try to locate your liver span. I'm going to percuss up to your ribs, okay? Okay, so I got change in sound here. And then we're going to have one more in just a second. Now I'm going to come down, listen for the change up here. Oh, that was quick. Okay.
Now I'm just going to listen, okay? Has your appetite been good? Yeah. Okay, very good. All right. Now I'm just going to feel. Just let me know if you have any pain, okay? No pain?
No.
Okay.
On inspection, the abdomen looks symmetrical. I don't see any bulging, no nodules, no bluish discoloration, nor the rash or redness over the abdomen. Can you lift your head a little? And I don't see any herniation with increased pressure on the abdomen. Next, I'm going to auscultate. So we're gonna first auscultate the bowel sounds. And that's in all 4 quadrants. I can hear bowel sounds in all 4 quadrants. I'm going to auscultate the epigastric region for a venous hum. And then the umbilicus. No venous hum noted. Next, I'm going to auscultate the aorta. No bruit present. The renal arteries. No bruit. Iliac artery. And the femoral artery. There's no bruit present in either of those. So next we are going to do percussion. So I hear tympanic and dull sounds. I'm going to percuss the liver for any friction rub. None present, and the spleen, none present. I'm also going to percuss to find the liver margins. So I'm gonna start there, dull. Hold on, I need to cut it. And this is about 4 centimeters, which is normal. So there's no liver enlargement. Next, I'm going to palpate. So let me know if you feel any pain.
Tickles.
Any pain? And I don't feel any lumps or bumps or any masses. Okay, I'm gonna do a little deeper palpation. Let me know if it hurts.
Tickles.
Just tickles.
Yeah.
So no pain?
No.
Okay, I have to go a little more deeper, okay?
Okay. I don't know why it tickles
Okay.
so much.
So any pain? Do you feel any pain anywhere?
No.
Row 6 sign is negative, and then okay. Try and take a deep breath. Okay, there. Can you take a deep breath?
Okay.
Breathe out. Any pain?
No, it just
Okay,
tickles.
just tickly, that's okay. Some people do have more than usual. So next I'm going to palpate the liver. Can you relax?
Okay, sorry.
Take a deep breath. Okay, I don't feel the liver. It's okay, I'm not supposed to feel it.
Oh, okay. I thought that meant...
Take a deep breath. Breathe out. Okay.
You feel my kidney?
No, that was trying the spleen. Okay, take a deep breath. Breathe out. No, I don't feel it. Next, I'll do the kidney.
Okay.
So deep breath again. Breathe out. Not palpable. Deep breath again. Breathe out. No, so kidneys are not palpable, and that is all normal. That's what we want.
Okay.
There's no tenderness anywhere, and yeah, we already said McBurney's and row 6 sign was negative.
I'm just going to take a listen in all 4 quadrants to hear your bowel sounds. Good. So bowel sounds are present. I hear high-pitched gurgling. If I didn't hear it, I would wait for 5 minutes in each quadrant. I'm going to percuss now. I hear a tympanic sound there over the intestines, and then it's dull over the liver, dull over the spleen, and tympanic over the intestines in the lower left quadrant. So now I'm going to just palpate your abdomen. Just let me know if you feel any tenderness, okay? So in the lower left quadrant, we have the sigmoid colon and the appendix. And then in the upper right quadrant, we have the liver and gallbladder. And over in the upper left quadrant, we have the stomach, pancreas, and the spleen. And in the lower left quadrant, we have the sigmoid colon. Did you feel any tenderness during that? Okay, so she reports no tenderness, and I do not feel any muscle rigidity or guarding, so her abdomen appears normal.
Which is very good. Alright, I'm going to move down to your stomach, okay? Do you have any stomach problems, pain, uncomfortableness, regular bowel movements? Alright. I'm going to start by listening, okay? I'm going to pull your shorts down just a little bit. Everything sounds good. Lots of bowel sounds. Now I'm going to percuss, okay? Your aorta was also very strong when I was listening. And now I'm going to palpate your stomach. So I'm going to start with a light touch. Let me know if anything becomes uncomfortable. And now I'm going to go into a deeper palpation, so please let me know if it becomes uncomfortable.
Abdomen now. So I'm going to lift your shirt up a little. Okay, so the abdomen is flat and round, no lesions or wounds or anything like that. I'm going to listen in all 4 quadrants.
Spread your arms slowly. And muscle strength looks perfectly fine. 0 to 5 looks fine. She can hold it under gravity and just ask for the forward knee.
Okay, so there are active bowel sounds in all 4 quadrants. I'm going to do some percussion.
No breakdowns. I'm going to assess your refill quickly on this arm.
Okay, so there is resonance heard. Now I'm just going to palpate and you can just tell me if you feel any pain. Okay. Okay, so there's no pain on palpation and no rigidity, no muscle guarding, and no tenderness or masses. So.
Next, I'll get you to go ahead and lay back for me. Next, we're going to be percussing the quadrants of the stomach, noting any resonance, any dullness at all. Everything sounds normal. There's no abnormal sounds noted. We would then palpate begin by attempting to palpate, percuss the liver at the mid-clavicular line. We would note this in centimeters and chart appropriately. Next, we would go ahead and try to palpate the organs of the stomach. This would consist of the liver, both kidneys on both sides. Sarah, do you have any tenderness?
No.
Okay. We would also attempt to palpate the spleen. And then finally the aorta. Okay.
I'm going to auscultate all 4 quadrants. Okay. Alright. Normal active bowel sounds noted in all 4 quadrants. Now I'm going to percuss your abdomen. I'm going to tap on it, okay? Sounds hollow. Alright, sounds hollow in all 4 quadrants. Now I'm going to lightly palpate your abdomen. Tell me if you feel any tenderness at all. Now I'm going to deeply palpate. Do you have any tenderness? No abnormalities noted. Palpating the liver. Feels normal. I'm going to listen to the aorta and the renal arteries. No bruits or abnormalities noted.
Okay, so first I would do by inspecting. Abdomen is nice and flat. Skin would be warm to the touch. Okay, for this I'm actually going to go on and just go ahead and auscultate first. And just all 4 quadrants. Bowel sounds are normal active. Now I'm going to percuss. I'm going to percuss your spleen. All right, and your liver, which is at the right midclavicular line. Sorry. Actually, I need that pen and ruler. It'll be about here. Do you care if I mark on you? Okay. Sorry. Maybe I'm pulling your shirt up. Okay. Get my ruler. Okay. Oh, right on the about 7 centimeters, which would be normal in females. All right. So next I'm going to start by palpating. Light palpation. Tell me if you have any tenderness. Okay, I'm going to do some deep palpation. All right, great. Now I'm going to palpate for your spleen. Take a deep breath in. Okay, and breathe and relax. And I'm going to have you do one more deep breath in. I'm going to palpate for your liver. All right. Okay, now I'm going to palpate your kidneys. Okay, and your aorta. Okay, now I'm going to listen to your arteries in your abdomen. We'll start with your aorta. And your renal. And your iliac arteries. And your femoral. And in a real exam, it would be skin to skin, but for the purpose of the video, we're moving close on.
Oh, have you had any nausea, vomiting, or diarrhea lately? Okay, when was the last time you had a bowel movement?
This morning.
This morning? Okay, perfect. So now I'm just going to pull your shirt up to expose your abdomen, okay? So I would look at the size, shape, and the symmetry of her stomach and look for any abnormal pulsations. Next, I would auscultate her bowel sounds in all 4 quadrants with the diaphragm of my stethoscope. Next, I'm going to auscultate the aorta with the bell of the stethoscope and listen for any bruits. No bruits noted. Okay, so if I would auscultate each quadrant for 5 minutes if I did not hear any bowel sounds. So now I'm going to touch your abdomen. I'll use one hand and then I'll use 2, okay? Just let me know if it's too uncomfortable for you. Okay.
So what we're going to do is percuss at each quadrant of the abdomen. And what we're listening for is, areas of tympany and dullness. Most of the abdomen will have tympany, specifically as over like the stomach bubble, but also the other areas, if they're completely full of gas, will also be tympanic. You might have some scattered areas of dullness associated with stool or something like that, but if there's a large mass, you'll have a larger area of dullness. This can give you some idea as where you should focus your palpation on based on where there might potentially be masses located. So for our percussion technique, you're going to use the same technique you would have used for the pulmonary exam. And again, just want to press your finger down and gently tap, again, creating the sound. And you want to do it each in one of the 4 quadrants. So the lower right and left quadrant and the upper right and left quadrant. And we noticed that he was generally tympanic in most areas. So next we want to be able to do percussion for the organs. So for both the spleen as well as for the liver. So for the spleen, what we're going to do is just to try and do a brief percussion to see if there's any evidence of splenic enlargement. So where you want to place your finger is at the anterior axillary line at approximately the lowest rib space. And with the patient just breathing comfortably, you want to percuss, and it should be tympanic because you're over the area of the stomach. So I'm going to ask you to take a breath and hold it briefly. And relax. you notice that it was still tympanic. That is because he does not have a splenic enlargement. If it becomes dull or is dull in either of those percussions, that suggests there might be enlargement of the spleen. So next what we need to percuss for is enlargement of the liver, and for liver span specifically. So we want to percuss both the superior border of the liver as well as the inferior border of the liver. We recommend that you go down from above for the superior portion and up from below for the inferior portion of the liver. And taking note of the location where it shifts from that sort of more tympanic sound to the more dull sound of a solid organ. And take note of the range of that is. You want to do this in the area of the midclavicular line. Typically, a liver span should be somewhere between 6 and 12 centimeters if it's normal. And then up from above. Up from below. And we heard the difference here and approximately here. And take note of the distance that you see.
Now if you could just put your hands down by your side, I'm just going to more closely inspect your tummy. I'd now like to move on to feel different areas of the tummy. Can I just check before I do that you don't have any pain at all?
No, I don't.
James, I now need to press a little harder. James, could you now take some deep breaths in and out for me? James, I'm now going to tap on your tummy. If you could roll onto your right hand side for me, James. And roll back. I'm now just going to listen to your tummy.
Okay, now I'm going to auscultate the abdomen, and we'll auscultate at a minimum at 4 quadrants. Okay, and you have positive bowel sounds in all 4 quadrants. Now I'm going to go ahead and auscultate the aorta using the bell. And there are no bruits. Okay, next I'm going to percuss the abdominal quadrants. And percuss for the size of the liver. And it should be between about 6 and 12 centimeters, okay? Now we'll go ahead and palpate the abdomen, first lightly. Just tell me if you feel any discomfort.
Okay.
And then a little more deeply. Okay? And now I'm going to palpate your liver. Go ahead and breathe in for me. And out. Good. And palpate the spleen. Go ahead and breathe in. And out. Good. And palpate for the kidneys. And for the kidneys. Okay? And then I'm going to palpate the size of the aorta. And that is very normal. Okay. Finally, I'm going to check your inguinal region. All right? Just have you straighten your legs out. And here, I'm just going to have you hold your underwear to the side. Good. And here, I'm checking and palpating for any femoral hernias, also for femoral pulses, and inguinal nodes. Okay? And then finally, auscultate for femoral bruits. Okay, and we'll do the same on the other side. And I'll just start by auscultating here. Okay.
Alrighty. So I do not see any lesions, any change of color, no sweaty, clammy skin. Okay. Now let's listen. And I'm going to listen with the diaphragm. Start with the right lower quadrant.
Okay.
Good. And then the right upper. Good. Left upper. And then your left lower. Good. And your bowels are moving just fine. When was your last bowel movement?
Yesterday.
Good. And then I'm going to slightly palpate, just slightly. Any discomfort?
No.
Okay. Alrighty. Good. I do not feel any masses or lesions, okay? So now I'm gonna do the same thing but a little bit deeper, a little bit more pressure. Good. Tell me when you feel any pain or discomfort. And good. I do not feel anything outside the normal. Alrighty. Alrighty. I'm gonna come back here and check on your liver. Okay. Great. And then on your left, I'll check on your spleen. And I hear your gastric bubble right there. Okay. I will listen to your main vessels that run in your belly. And I'm going to use the bell. I'll check your renal. Good. Now I'll check your iliacs. Good.